Causes and Prevention of Infertility. Hello guys, welcome to my channel. Every human being has the right to the best possible physical and mental health. Individuals and couples have the right to choose how many children they want, when they want them, and how far apart they want them to be. Infertility can prevent these basic human rights from being realized. Infertility treatment is thus a crucial component of realizing people's and couples' right to have a family. Infertility treatment can also help to reduce gender disparity. Despite the fact that both men and women can experience infertility, women in a relationship with a man are frequently thought to be infertile, whether or not they are. Infertility has severe negative social consequences for infertile couples, especially women, who are more likely to endure violence, divorce, social shame, emotional stress, despair, anxiety, and low self-esteem. Infertility is a condition of the male or female reproductive system described by the inability to conceive after a period of 12 months or more of unprotected sexual activity. Infertility affects millions of people worldwide who are of reproductive age, as well as their families and communities. Both men and women can be affected by infertility. If a woman has attempted to get pregnant for a year and hasn't used birth control, she is termed infertile. If a guy has too few sperm or his sperm are too ill to join with a woman's egg, he is deemed infertile. Many couples have no problems getting pregnant. There are, unfortunately, several elements that can make it difficult for some people. Infertility in men is most usually caused by issues with semen ejection, sperm absence or low levels or defective morphology and motility of the sperm. There are two different types of infertility. There is the primary infertility and secondary infertility. Primary infertility occurs when a person has never had a pregnancy, while secondary infertility occurs when a person has had at least one past pregnancy. The inability to conceive is the most common sign of infertility. There could be no additional signs or symptoms. Women may experience problems with their menstruation, such as pain or unusual bleeding. Erectile dysfunction can be a problem for some men. Other than not being able to conceive, most couples will experience no other symptoms. Infertility can be caused by a variety of causes that affect both the male and female reproductive systems. However, the causes of infertility are not always easy to pinpoint. Infertility in women can be caused by a variety of factors, including tubal diseases such as blocked fallopian tubes, which are caused by untreated sexually transmitted infections, STIs, or complications of unsafe abortion, postpartum sepsis or abdominal or pelvic surgery, uterine disorders such as endometriosis, septate uterus or benign fibroids, abnormalities with the cervix, polyps in the uterus, or the shape of the uterus are all examples of uterine or cervical abnormalities. Uterine fibroids are non-cancerous, benign tumors that block the fallopian tubes or prevent a fertilized egg from implanting in the uterus, resulting in infertility. Ovulation abnormalities are problems with egg release from the ovaries. Hormonal abnormalities, such as polycystic ovary syndrome, are among them. Hyperprolactinemia, or having too much prolactin, the hormone that drives breast milk production, can also cause ovulation problems. Thyroid hormone levels that are excessively high, hyperthyroidism, or too low, hypothyroidism, might disrupt the menstrual cycle and lead to infertility. Excessive activity, eating disorders, and malignancies are all possible underlying reasons. Pelvic adhesions are scar tissue bands that bind organs and can develop as a result of a pelvic infection, appendicitis, endometriosis, or abdominal or pelvic surgery. The treatment of cancer. Female fertility is frequently harmed by certain diseases, notably reproductive tumors. Radiation and chemotherapy both have the potential to impact fertility. Endocrine system disorders that result in reproductive hormone imbalances. Hypothalamus and pituitary glands are part of the endocrine system. Pituitary cancer and hypopituitarism are two examples of prevalent illnesses that impact this system. Ovarian insufficiency. When the ovaries stop working and menstruation stops before the age of 40, this is known as primary ovarian insufficiency, early menopause. Although the cause is generally unknown, immune system illnesses, some genetic conditions such as Turner syndrome or carriers of Fragile X syndrome, and radiation or chemotherapy treatment have all been linked to early menopause. Infertility in males can be caused by a number of factors. Because of changes in the background incidence of STIs or the ages of the populations tested, the relative importance of various causes of female infertility may vary from nation to country. Infertility in men can be caused by a variety of factors, including obstruction of the reproductive system, resulting in problems with semen ejection. This can happen in the tubes that transport sperm, such as ejaculatory ducts and seminal vesicles. Injuries or infections of the vaginal tract are the most common causes of blockages. Hormone imbalances produced by the pituitary gland, brain, and testicles cause hormonal diseases. Testosterone, for example, regulates sperm production. Pituitary and testicular tumors are examples of illnesses that cause hormonal imbalance. Testicular sperm failure, which can be caused by varicocele or medicinal therapies that harm sperm-producing cells, such as chemotherapy. Sperm function and quality issues. Fertility is harmed by conditions or settings that induce aberrant sperm shape, morphology, and movement motility. The use of anabolic steroids, for example, might result in aberrant sperm parameters such as sperm count and shape. Infections like chlamydia, gonorrhea, mumps, or HIV can cause abnormal sperm production or function due to undescended testicles, genetic flaws, health issues including diabetes, or infections like chlamydia, gonorrhea, mumps, or HIV. Varicocele, or enlargement of the veins in the testes, can potentially impact the quality of sperm. Smoking, heavy alcohol consumption, and obesity are examples of environmental and lifestyle variables that can influence fertility. Furthermore, environmental contaminants and chemicals can be directly hazardous to gametes, eggs, and sperm, resulting in a decrease in their number and poor quality, culminating in infertility. Although most types of infertility in men cannot be prevented, the following techniques may help. Avoid drug and tobacco use, as well as excessive alcohol consumption, as these can all lead to male infertility. High temperatures, such as those seen in hot tubs and baths, can temporarily impair sperm production and motility. Avoid chemicals that can influence sperm production, such as those found in the workplace or in the environment. Prescription and non-prescription medications that may affect fertility should be avoided. Discuss any medications you take on a regular basis with your doctor, but don't discontinue taking prescription medications without first seeking medical counsel. Moderate exercise is recommended. Regular exercise can help to improve sperm quality and increase sperm count. There are a variety of measures that women can use to boost their chances of becoming pregnant. Stop smoking. Tobacco has a number of detrimental consequences on fertility, as well as your overall health and that of the fetus. If you're thinking about starting a family, now is the time to quit smoking. Alcohol and illegal drugs should be avoided. These chemicals may make it difficult for you to conceive and deliver a healthy baby. If you're attempting to conceive, don't drink alcohol or use recreational substances like marijuana. Caffeine should be consumed in moderation. Caffeine should be avoided by women who are attempting to conceive. Consult your doctor for advice on how to take caffeine safely. Moderate exercise is recommended. Regular exercise is beneficial, but exercising to the point where your periods are irregular or non-existent can have an impact on your fertility. Avoid extremes in your weight. Obesity and infertility can both be caused by being overweight or underweight. Treatment for infertility is determined by the cause of your infertility. Medicine or surgery may be used to treat women. The ovaries are stimulated by the most frequent medications used to treat female infertility. This raises the odds of becoming pregnant by assisting the ovaries in producing more eggs. If there are obstructions or difficulties with the fallopian tubes, surgery may be required. It's also used to remove endometriosis, fibroids, polyps, or scarring, all of which can interfere with fertility. Medicine and surgery can be used to help men. Medicine may be administered if they have erectile dysfunction or difficulty ejaculating. It can be very challenging to deal with infertility on an emotional level. Relationships might be strained by the disappointment of not becoming pregnant after trying each month. It can also be detrimental to your emotional well-being. When you can't have children, it's painful to watch friends, relatives, and even strangers have them. If you're having trouble getting pregnant, talk to your doctor about ways to deal with disappointment each month. A support group can sometimes be beneficial. After failing to conceive a child through pregnancy, some couples choose to adoption. Always know that adoption is an option. Thank you for watching. Please be sure to like and share this video with your friends. And if you have not subscribed, kindly do so now. Turn on your notification so you can see new contents when I drop them. Till next time, bye guys.